Have you ever felt your hand go numb for just a moment, or struggled to find the right word mid-conversation, then shrugged it off like nothing? What if I told you that those seemingly harmless moments could actually be your brain's silent cry for help? Welcome to Senior Health Tips. Today we're not just sharing health advice, we're talking about something that could protect your independence, your memory, and even your life. Because strokes aren't always dramatic. They don't always come with a fall or a sharp pain. Sometimes, they begin subtly: a slurred word, a bit of dizziness, a strange tingling on one side of your face. And that's exactly why strokes are so dangerous. They hide behind symptoms we often ignore, dismiss, or mistake for aging. In this video, we're going to walk you through the critical warning signs that doctors urge seniors to recognize immediately. You'll learn how to perform a simple 1-minute check at home, understand the difference between a stroke and a mini-stroke, and what to do in those first crucial minutes to prevent permanent damage. But why are we talking specifically to you, our senior viewers? Because the reality is, if you're over 65, your risk of stroke doubles with each decade, and if you delay action, even by minutes, you could lose your ability to walk, speak, or remember the faces you love. So take a breath, stay with us, and let's make sure you know exactly what to look for before it's too late. Is it just a dizzy spell, or the first sign of a stroke? That's a question that far too many seniors ask themselves too late. Stroke rarely begins with a loud warning. Often, it slips in ironically, masked as something ordinary. A bit of slurred speech after dinner, a sudden wave of dizziness while getting up from the couch, a tingling sensation in one arm that lasts only a few seconds, or a headache, sharp, sudden, and unlike any pain experienced before. For many, these signs are brushed off. Fatigue, low blood sugar, maybe poor sleep, surely nothing serious. But what if it is? What if that moment of confusion wasn't just tiredness, but a signal that oxygen wasn't reaching a part of the brain? According to the American Heart Association, every minute that the brain is deprived of blood during a stroke, nearly 2 million neurons die. That's not just numbers, it's speech, movement, memory, independence, slipping away with every second. The tragedy is, many of these outcomes can be avoided if the warning signs are recognized early enough. Unfortunately, many seniors and even their caregivers fail to see the danger in time. The earliest signs of stroke are often mistaken for harmless issues. Slurred speech is excused as sleepiness. Numbness is chalked up to sitting the wrong way. That thunderclap headache is dismissed as stress. It's this pattern of denial and delay that turns manageable strokes into devastating ones. This phenomenon has a name: recognition delay. It's one of the leading reasons why stroke outcomes are worse in older adults. The longer it takes to identify a stroke and begin treatment, the more likely a person is to suffer from long-term complications like paralysis, speech loss, or permanent cognitive decline. Yet stroke doesn't always play fair. Sometimes, symptoms appear briefly and disappear just as fast. A drooping face that recovers within minutes. A numb hand that returns to normal by the time help is called. These fleeting symptoms are especially dangerous because they create false reassurance. Just because the signs go away doesn't mean the brain wasn't damaged or that another more severe episode isn't coming. In the United States, stroke is the 5th leading cause of death, and a leading cause of serious long-term disability. Seniors are especially vulnerable, not just because of age, but because of how easily early signs are mistaken for normal aging. The reality is that stroke doesn't care about routines or schedules. It strikes in the middle of everyday life, while watching TV, doing dishes, walking the dog, and it doesn't wait until the next checkup. So how can someone tell the difference between a minor issue and a life-threatening emergency? That's where things get serious. Because once a stroke is suspected, every second becomes precious. Hospitals and emergency responders follow strict protocols for stroke treatment. but it all depends on how quickly someone seeks help. Studies show that patients who arrive at the hospital within the first 3 hours of symptom onset are significantly more likely to recover with minimal or no disability. That short window is often called the golden hour, even though it may stretch up to 4.5 hours in some cases. But what stops people from acting quickly? It's not fear, it's doubt. Doubt that something so subtle, so ordinary, could be dangerous. That's why education is so critical. Recognizing the early signs of stroke isn't about medical training, it's about awareness. Knowing what a stroke might look like, even when it doesn't feel serious. Because often the only chance to act is the first one, and waiting for certainty can cost everything. Some warning signs to never ignore include sudden confusion, trouble speaking, or understanding speech, unexpected numbness or weakness, especially on one side of the body, sudden trouble seeing in one or both eyes, loss of balance or coordination, and yes, that sudden, unexplained headache that doesn't feel like any headache before. These are the clues. The question is whether they'll be recognized in time. But how can one know if it's serious or just another bad day? There's a fast, simple test used by hospitals across the country. Recognizing the early signs of a stroke doesn't have to be complicated. In fact, the method used by hospitals and emergency responders across the United States is simple enough to remember with one easy word: FAST. Recommended by the CDC and endorsed by leading neurologists, the FAST test is a quick screening tool that anyone can use right at home in under a minute. Each letter stands for a critical function affected by stroke, and together they form a life-saving checklist. F is for face. Ask the person to smile. Watch closely. Does one side of the mouth droop? Is their smile uneven? A lopsided or drooping face can indicate that the part of the brain controlling facial muscles is no longer receiving proper signals. The brain's motor cortex, responsible for voluntary muscle movements, is often impacted in strokes, especially those affecting the middle cerebral artery, which supplies the areas of the brain controlling the face. A is for arms. Ask the person to raise both arms in front of them. Are they able to lift both evenly? Does one arm drift downward or feel weak? This simple test checks whether the brain's command to the limbs is getting through. If one arm drops or feels numb, it may signal damage in the opposite side of the brain. For example, weakness in the right arm can mean a stroke in the left hemisphere. C is for speech. Ask them to repeat a simple sentence, like "the sky is blue." Is their speech slurred, confused, or hard to understand? Do they struggle to form words or mispronounce them? The brain's left hemisphere controls language for most people, and when stroke hits areas like Broca's or Wernicke's region, speech becomes jumbled, garbled, or stops altogether. T is for time. Time to call 911. If any of the above signs are positive, don't wait to see if it gets better. Stroke care is a race against the clock, and delay can mean the difference between full recovery and permanent loss. Even if symptoms seem mild or disappear after a few minutes, emergency evaluation is still critical. Some people experience a transient ischemic attack, a mini-stroke that passes quickly, but often warns of a major stroke soon to follow. The beauty of the FAST method lies in its simplicity. No equipment, no medical training, just observation and action. That's why health officials urge families to print out the FAST checklist and post it somewhere visible on the refrigerator, near the phone, or in a caregiver's daily planner. For seniors living alone or with chronic conditions, having this tool nearby could mean the difference between getting help in time or too late. It's worth noting that stroke symptoms don't always appear all at once. Some may develop over minutes or even hours, which makes staying alert even more important. If something feels off or abnormal, the FAST test provides a structured, trusted way to assess the situation. Better to do the test and be wrong than to hesitate and be too late. And for those caring for aging parents or spouses, teaching them the FAST method empowers the whole household. Recognizing a stroke is one thing, but what kind of stroke is it, And why does that matter so much? Not all strokes are the same. In fact, understanding the type of stroke is just as critical as recognizing the stroke itself. That's because the two major types, ischemic and hemorrhagic, require very different treatments, and knowing which one is occurring can literally mean the difference between life and death. Ischemic strokes, which account for about 87% of all cases in the United States, happen when a blood clot blocks or narrows an artery leading to the brain. Think of it like a traffic jam in your brain's highway system. The clot, often formed in the heart or large neck arteries, stops blood from reaching a part of the brain, depriving it of oxygen. Within minutes, brain cells begin to die. The causes behind ischemic stroke are often linked to chronic conditions, like high blood pressure, high cholesterol, diabetes, or irregular heart rhythms, such as atrial fibrillation. In many cases, a fatty plaque may rupture inside a blood vessel, triggering the clotting process. Other times, a clot forms elsewhere in the body and travels to the brain, a process called embolism. These strokes tend to come with symptoms like facial drooping, arm weakness, slurred speech, or sudden confusion. On the other hand, hemorrhagic strokes are far less common, but far more deadly. They occur when a weakened blood vessel in the brain bursts, causing bleeding into the surrounding tissue. The most common causes include uncontrolled hypertension, aneurysms, or trauma. When the blood vessel ruptures, it floods the brain with blood, which not only damages the tissue directly, but also increases pressure inside the skull, causing further injury. Unlike ischemic strokes, hemorrhagic strokes may present with different warning signs. Most notably, a sudden, severe headache, often described as a thunderclap, or the worst headache of my life. Other symptoms can include sudden loss of consciousness, vomiting, seizures, or vision disturbances. These signs are often more dramatic and immediate than in ischemic stroke, making them harder to ignore, but also harder to treat. What makes hemorrhagic stroke particularly frightening is the speed at which it can cause irreversible damage. The brain isn't just starved of oxygen, it's crushed under pressure from the internal bleeding. This is why rapid identification is so vital. CT scans or MRIs are required to distinguish between ischemic and hemorrhagic strokes. The treatments are completely different. Ischemic strokes are typically treated with clot-busting medications, like TPA or catheter-based removal of the clot. But these treatments would be catastrophic for hemorrhagic strokes, where thinning the blood would worsen the bleeding. In those cases, surgery may be needed to stop the bleeding, relieve pressure, or repair the blood vessel. Then there's a third, often overlooked type, the transient ischemic attack, or TIA, often called a mini-stroke. Unlike full-blown strokes, TIAs are temporary blockages that resolve within minutes to hours and don't leave permanent damage. But that doesn't make them harmless. In fact, a TIA is one of the strongest predictors of a future stroke. According to the National Stroke Association, up to 40% of people who experience a TIA will go on to have an actual stroke, often within a matter of days. It's the body's final warning call, and it must never be ignored. This is why identifying not only the presence of a stroke, but the type, is so essential. It determines what can be done and how fast. It determines which hospital team is activated, what kind of scan is run, and which medication or surgery might be life-saving. The stroke's origin guides the entire course of treatment, and misidentifying it can be fatal. The urgency of proper diagnosis underscores the need for immediate hospital transport. Not waiting at home, not calling the family doctor, not Googling symptoms. Just get to the ER. In addition, understanding the difference helps families know what to expect. Recovery paths, risks of recurrence, and even post-stroke complications vary depending on the stroke type. Ischemic stroke survivors may face mobility or speech challenges. Hemorrhagic stroke survivors may deal with memory loss, personality changes, or ongoing seizures. And those who've had a TIA have an urgent window of opportunity to make lifestyle changes, control risk factors, and undergo testing to prevent a major stroke from striking. Many believe strokes are a danger only for the very old, those in their 80s or beyond. But new research is painting a different picture. Stroke doesn't discriminate by age, as much as once believed. The next part may surprise many. For decades, stroke has been seen as a disease of old age. But in recent years, something has shifted. According to data from the Centers for Disease Control and Prevention, CDC, stroke rates in adults under the age of 50 have been rising steadily in the United States. In fact, the increase has been most dramatic among adults in their 30s and 40s, an age group once thought immune to such catastrophic brain events. So what's fueling this alarming trend? A closer look reveals a perfect storm of lifestyle factors that are placing younger generations at higher risk than ever before. Chronic stress brought on by demanding jobs, financial pressures, and the constant connectivity of the digital age is driving up blood pressure, weakening cardiovascular health, and fueling systemic inflammation. It's not uncommon today to find a 35-year-old juggling 3 jobs, barely sleeping, eating on the run, and experiencing daily anxiety spikes. That kind of relentless pressure does more than wear down the mind. It damages the heart and blood vessels. Alongside stress is the growing prevalence of metabolic disorders. Type 2 diabetes, once considered rare in younger people, is now being diagnosed with increasing frequency in those under 40. High cholesterol and obesity, fueled by sedentary lifestyles and poor dietary habits, are setting the stage for early vascular damage. A diet high in processed foods, sugars, and trans fats creates the ideal conditions for arterial plaque to form, narrowing the blood vessels that feed the brain. Meanwhile, physical inactivity, thanks in part to desk jobs, long commutes, and screen-based entertainment, is depriving the cardiovascular system of the movement it needs to stay resilient. Another silent contributor is undiagnosed or uncontrolled hypertension. High blood pressure can be asymptomatic for years, while silently wreaking havoc on arteries. It's been called the silent killer, for good reason. Young adults often skip routine checkups, assuming they're too young to worry about heart or brain health. That assumption has become dangerously outdated. Lifestyle isn't the only factor. Some younger adults may carry genetic predispositions to clotting disorders, aneurysms, or congenital heart issues. But regardless of cause, the outcome is the same. A growing number of people in their 30s and 40s are now facing the reality of strokes. Some with permanent disability, others with their lives cut short entirely. This isn't just a warning for younger individuals, it's also a call to action for families of seniors. It's easy to dismiss symptoms in a spouse or adult child, thinking they're too young for a stroke. That hesitation can lead to devastating consequences. Whether the person is 75 or 35, the clock is ticking the moment symptoms appear. One of the greatest dangers is underestimating the urgency simply because of age. Stroke doesn't discriminate. It doesn't wait for retirement or gray hair. It strikes when conditions allow, and increasingly, those conditions are found in younger bodies. With stroke trends shifting downward in age, awareness must shift too. Everyone, regardless of age, should understand stroke symptoms, know their risk factors, and be prepared to act. That means educating teens, young adults, and middle-aged workers just as much as retirees. It means screening earlier, checking blood pressure more frequently, and refusing to ignore warning signs just because they show up in someone who's too young. Because when the symptoms strike, whether in a 35-year-old or a 75-year-old, what should happen next becomes a matter of survival. When stroke symptoms strike, the face begins to droop, the arm weakens, speech becomes slurred. There's no time to hesitate. The correct response is simple. Call 911 immediately. Urgent medical services, EMS, are trained to suspect stroke before even arriving at the hospital. Paramedics can start life-saving interventions in the ambulance, provide crucial pre-notification to the nearest stroke center, and ensure the patient is met with a prepared team ready to assess and treat within minutes. This swift coordination saves precious brain tissue and greatly improves the chances of a full recovery. Despite that, hesitation remains all too common. Many wait to see if symptoms go away, worry about overreacting, or attempt to drive someone to the hospital themselves. These delays can be deadly. Driving a stroke patient often means slower response times caused by traffic, hesitation, or misjudgment. Calling 911, in contrast, ensures priority transport, real-time medical assessment, and often bypasses standard traffic delays. Speaking up early could mean the difference between walking out of that hospital or never walking again. Modern stroke interventions also depend on a narrow window of opportunity, sometimes referred to as the golden window. For ischemic strokes, the most common type, treatment with tissue plasmalogen activator, TPA, a clot-busting medication, must occur within 4.5 hours of symptoms starting. Some stroke centers also offer mechanical thrombectomy, using a catheter to remove clots from larger vessels, which can be effective up to 6 hours or more in selected cases. Studies show that patients treated within the first 3 hours are significantly more likely to recover without lasting disability. Every minute counts, and every moment of delay can translate into millions of lost brain cells. Hemorrhagic strokes, though less common, are often more devastating. In these cases, bleeding in the brain can raise intracranial pressure rapidly, compressing surrounding tissues. Speed is equally critical here. Treatment shifts from dissolving clots to stopping bleeding, relieving pressure, and sometimes performing life-saving surgery. When hemorrhage isn't contained, brain swelling, seizures, and irreversible damage can follow within hours. The difference between fast and slow response isn't merely academic, it's deeply personal. Imagine two patients with identical stroke symptoms. One gets an ambulance at home, arrives at a stroke-ready hospital within 60 minutes, and receives TPA and possibly a thrombectomy. The other waits at home, thinking, "I'll see if it gets better," or uses Uber to the ER. Arriving too late, the first patient often walks out independently, resumes hobbies, and remembers loved ones. The second may suffer paralysis, speech loss, ongoing memory problems, or even die. The consequences of delayed response are permanent, and sometimes tragic. Preparation matters, and that's where a stroke action plan comes in. Think of it like a fire escape plan. It guides everyone in your household through a crisis. Families should post a fast checklist on the fridge or near the home phone, ensuring everyone knows the symptoms and the right steps. Emergency contacts and medical info should be clearly listed where EMS can find them. Seniors, especially those with risk factors like high blood pressure or diabetes, should carry medical alert bracelets or wear identification that states essential information, and families should discuss who will call 911 if stroke is suspected, ensuring nobody freezes up in an emergency. Prevention needs attention too. Measuring blood pressure daily, adhering to medications, keeping medical appointments, and maintaining regular exercise. But even with prevention in place, fast response remains the critical backup plan. Without it, years of good management can unravel in hours. One final thought: knowing what to do should go hand in hand with sharing what you know. You could be the difference between recovery and tragedy for someone you love. So when you leave this screen today, don't just like and subscribe. Talk to your loved ones, post the fast poster on the fridge, and practice the steps. Empower your family and community to act swiftly. Knowing what to do is the first step, but sharing this knowledge could be what saves someone close tomorrow. Thank you for watching Senior Health Tips. If this video provided value, please hit the like button, subscribe to our channel, and tap the notification bell so you're alerted when new content arrives. Stay safe, stay informed, and stay prepared.